Hi, welcome to our show today. Our guest is Dr. Jeff Geske. Dr. Jeffrey Geske is an academic cardiologist and practicing physician in the Department of Cardiovascular Medicine at Mayo Clinic. Dr. Geske's research focuses on patients with structural heart disease, such as valvular heart disease and hypertrophic cardiomyopathy. He's an MD medical doctor with formal training in internal medicine, cardiology, and multimodality imaging. He is board certified in cardiology and echocardiography. Dr. Geske has written more than 140 publications and recently was promoted to professor of medicine. He is the course director for the Mayo Clinic Alix School of Medicine cardiology course and is co-director of the Mayo Clinic Cardiovascular Board Review. Outside of work, Jeff enjoys collecting and playing vintage video games. He's married with 3 daughters. He's also my brother. Thanks for joining us today.
Yeah, I think the best accomplishment you saved for last there.
Because we both had so much to do with that.
Yeah.
Um, let's start with a little icebreaker. You've played video games as long as I've known you. What's a recent video game that you've been playing and that you have enjoyed?
Well, I actually recently picked up a used pinball machine. It's a Terminator 2 pinball game, and I found it in a barn. It was not working. It was in pretty rough shape, but with some help, I've replaced a bunch of the parts, replated the ramps, all the rubber had rotted, a battery had exploded in it, kind of put some sweat equity, some work into it, and now it's up and running. And it has really been fun, not only playing it now that it's up and running, but also seeing kind of all the inner workings and putting in the effort to restore it a bit. I was never really very good at pinball growing up. We didn't really have a pinball machine or anything like that. And whenever I would put some money in a machine, I wouldn't last that long. But it's been kind of fun having my own. I'm getting a little bit better, but I would still say that my oldest daughter has the household high score. So I'm not yet surpassing her.
Awesome. Okay, well, share with us a little bit about your background. That's maybe more the academic and background.
All right. I could probably focus on games the whole time, but I think that's a good idea. I grew up in a Pentecostal Christian home. My parents were both very strong in their faith, and I think they set a great example for both myself and my older sister. Ever since being a small child, I had an interest in medicine. Although being a Christian is central to who I am, I never really felt a calling to become a pastor or a missionary. And at many points in my education and training, it's been really apparent that becoming a medical doctor is the path that God has put aside for me. So after completing my undergraduate studies at the University of Minnesota, I went to medical school at Mayo Clinic. That's a 4-year program to receive my medical doctorate. And then after you get your medical doctorate, even though you're an MD, you really need additional training to become good at caring for patients. So I went through 3 years of internal medicine residency. And then after that, a total of 4.5 years that was spent in cardiology fellowship and advanced cardiac imaging fellowships. Once I completed that training, I've been on staff as a cardiologist at Mayo Clinic for more than 6 years. And as you said, my emphasis is really on structural heart disease, in particular, this hypertrophic cardiomyopathy. And I really enjoy medical education as well.
Doctor, when you were growing up, how did your family deal with the intersection of science and faith?
You know, it's been interesting. Growing up, everyone was an engineer. And I'm looking at an aerospace engineer with my sister. My father is a mechanical engineer, and it seems like everyone, all the uncles, it's not like what do you do? It's like what branch of engineering do you specialize in? And before going to medical school, I actually worked in a biomedical engineering capacity at Medtronic, so I had kind of thought about diving into that role. So I've been surrounded by science all throughout growing up. It was a really important part of my education and my childhood. It was everywhere. And similarly, my Christian faith and Christian values have always been a part of who I am. I was blessed to grow up in a Christian home and have such great role models. So I don't really see those as conflicting at all. And I'd say, really, the more I learn about the intricate complexities of biology and human physiology, I see the role of a creator there. It's important for Christians to know that exploring science and using scientific principles is healthy. I don't think that God wants us to be naive to the incredible things he has created, and faith does not mean shunning science.
Yeah. So when you were going into medical training, did you ever have a crisis of faith or question your belief in God?
Yeah, I think it's healthy to evaluate your beliefs and your faith. So I think I could say yes and be truthful to that. Um, I do not consider my Christian beliefs to be a blind faith, in that I don't believe what I do simply because it's what I heard in Sunday school growing up, or because it's what my parents or my sister believes. So when I've questioned my faith, I have found that it withstands those questions. Becoming a physician requires an incredibly long training pathway. And, as I've gone through studying for standardized exams or approaching a 30-hour shift, I have found that my faith is really helpful to me. I use a prayer during tough times to find peace. And while medical knowledge is vast and ever changing and can be really intimidating, I know that I work hard to stay up to date on medicine, but I also prayerfully seek guidance from God for the decisions that I make, both in my career and for the care of patients.
What role do you find that prayer has in the medical field?
Yeah, I think that I believe prayer matters. My prayer is central to my faith. It's something that I do daily. It's something that connects me with God. And I believe that Christians should pray for healing. But with that said, I don't think that prayer replaces the need for medical care, nor should it cause us to doubt that science and modern medicine are able to help with health. So again, I don't see the two at odds or opposing. I think that they work together.
Do you share your faith directly with your patients?
Well, that depends. My primary goal when I am in the role of physician is to put the needs of the patient first and to provide excellent medical care. Often that does not directly involve me sharing my Christian beliefs. I want to be an example of living for God, but it may not mean that I advertise those beliefs in the patient care setting. I will say, if a patient asks me to pray for them, I certainly would be happy to do that.
So before we discuss certain medical topics, can you clarify the difference between recommending best medical practices and giving patient-specific medical advice?
Yeah, so I think it's a great question. And first off, I'd say in our discussions today that these answers are my own. I haven't been prompted to give certain answers. The answers I give are mine and not that of my employer or a specific organization. I don't believe that I have any conflicts in our interview today. And your question brings up a really important point. As a physician, I see patients regularly, and whether it's in the hospital or the clinic, I have access to their medical information. I take a history, perform an exam, I review their medical testing, and with all that data in hand, I provide guidance based on medical guidelines, and we use shared decision making to determine the correct next steps for medical care. The patient-physician relationship really individualizes patient care. And that's different than a general discussion of medical topics. Thankfully, we have guidelines and expert groups such as the National Institute of Health, the Center for Disease Control, that help us to provide best practice recommendations that apply more broadly to a majority of people. And I think in general, when you're asking questions today, my answers would fall more along the lines of the latter there, in that I'm not reviewing each of your medical charts and providing specific diagnosis and treatment recommendations.
Do you care for patients with COVID-19, and are you an expert in that area?
So as a practicing medical physician, I certainly do care for patients with COVID-19. It's a real disease. COVID has affected many aspects of my job. I'm grateful that I have friends and colleagues who work in infectious diseases. Cardiology is my specialty, so I'm a heart doctor, not an infectious disease specific expert. But I would say that understanding how COVID can affect health, especially cardiovascular health, is important to me since I care for patients.
So we are more than a year and a half into this global COVID-19 pandemic. As a cardiologist, how has the pandemic impacted your practice?
A lot of ways. I think that's the short answer. Is a lot of ways. I've seen a lot of different impacts from COVID. Perhaps an obvious one is that now when I'm interacting with patients, both my patients and I wear masks, and I honestly don't really mind wearing a mask. I might have to use an extra breath mint every once in a while, but other than that, but for patients who are hard of hearing and rely on some amount of lip reading, wearing a mask can be tough. And so that's been an interaction that's really changed. I'd say as well that COVID has really stretched a lot of medical resources. For example, there have been some times where patients need heart surgeries on an elective basis, and there are fewer operative slots available, where we've had to cut back on our operating volume because of the pandemic. And hospital utilization has been very high lately. I just spent some time on hospital service, and the hospitals across Minnesota are very full.
Are there cardiac effects of COVID?
Yes, COVID can directly affect the heart. It can cause an inflammatory process of heart muscle. That the medical term for that is myocarditis. And myocarditis can weaken the heart's pump function. Perhaps more often than seeing a direct effect on the heart of myocarditis, we can see COVID affect the lungs or cause systemic inflammation, and that can then influence overall heart health. Patients with underlying cardiac conditions may develop weakening of their heart or heart failure because of difficulty of pumping blood through the lungs when the lungs are inflamed and infected. Another important thing that's maybe a less direct or a more indirect effect of COVID that I've really noticed is the importance of health maintenance. During the pandemic, again, people are interacting less, people are staying home. And because of that, sometimes the regular visits with doctors have had to be delayed or have been canceled. And management of chronic medical conditions, things like high blood pressure or high cholesterol, have caused more issues. So that's not really strictly COVID to blame, but it's an effect on chronic health management that relates to the pandemic and has adversely affected cardiac health.
So, what are the best ways to reduce the risk of COVID and these long-term medical issues?
Nothing here would be groundbreaking. I'll say that. Wash your hands, wear a mask. Masks are effective. Continue to practice social distancing, and with regards to specifics of that, I would pursue the recommendations as outlined by the CDC. And I think the last important step that I'd highlight is to get vaccinated against COVID.
Are you vaccinated, doctor?
Yes, yep, I am. Vaccines save lives. The COVID-19 vaccines have undergone huge, rigorous studies, and they've been found to be safe and effective. And I will say, what an answer to prayers that has been. As we went into this pandemic, that was that was very much on my mind. I hope that science is able to come through and develop a safe vaccine that's readily accessible and administered, and that has been a real answer to prayer. And furthermore, the monitoring of these vaccines has been very intense, and I think as it should be for something that we're so widely administering. But I think after looking at all the data personally, I agree with the CDC recommendations, and yes, I am vaccinated.
Well, I got my booster yesterday. My arm's a little bit sore today. Um, and recently, the FDA gave emergency approval for the Pfizer vaccine for kids ages 5 to 11. Has your 9-year-old been vaccinated, and why?
Yep. So I'll say again, I've been vaccinated. I received my booster just like you did, and I want to lead by example. And our whole family has discussed this. We want to lead by example. My wife has been vaccinated and is scheduled for her booster. My older two children, who are 12 and 15, are fully vaccinated. My 9-year-old received her first dose and is scheduled for her second dose as per the typical dosing schedule. We did this for our safety and for the safety of others, and I honestly believe it's the right thing to do.
What about rumors that there have been cases of heart inflammation that related to the vaccine? Does this change your mind about it? Is it true?
So it is true, and vaccines are a medical therapy. So it is not a placebo. There is possibility for risk, and myocarditis has been reported in some cases with the COVID-19 mRNA vaccines. Most cases have thankfully been very mild with complete recovery. And in my judgment, the possible adverse effects doesn't really alter the total risk-benefit relationship for vaccination for most people. And that's really in line with the recommendations of the CDC. In other words, the known risks of COVID-19 illness and its related complications far outweigh the potential risks of having a rare adverse reaction to vaccination, including myocarditis.
Well, that's good, really good to hear. Um, I hear of a lot of people talking about doing their own research. What can happen when people without a medical background try to find solutions that the vast majority of doctors and scientists have found not to be beneficial?
I think it's a really good question, and could really go deep onto a lot of different aspects. I will say that social media and access to the internet in general have changed how people consume information. And when you go to do your own research, a lot of what you find depends on how you ask the question. For example, if you were to go and Google evidence that the Earth really is actually flat, you will end up with skewed results. And along those lines, when you're looking at medical literature, which is written with medical terminology, not using the proper terms can also result in skewed results. Looking at what we've talked about so far, if you were to Google heart inflammation, you might find different results than if you were to Google myocarditis. And most medical literature would be using the medical terminology, and you might find literature that has misinformation that uses alternative terms. Further, online data can be presented in a convincing fashion without factual evidence behind it. In scientific literature, manuscripts, they undergo a series of peer reviews. You mentioned the 140 papers that I've written, but if you counted all the times I've had to rewrite things and resubmit things, again, it would probably be triple that number of times I've had to submit manuscripts, because others review it and they say, maybe you didn't do these statistics right, or I think that maybe you're drawing too much of a conclusion from the amount of data that you have. And so while that scientific peer review process is not without flaws, I think it helps to avoid bias. And that's not really present on the internet. People can post what they want. And even inside of medical literature, there are varied levels of quality. There are kind of top tier journals and middle tier journals and lower tier journals. And I think navigating that that landscape without the background to know what is the highest level data and how to interpret some of the statistics and some of the medical terms could be really challenging without the right resources.
So where can Christians go, or for that matter, for anyone go, for reliable resources when it comes to science and medicine and even vaccines?
Yeah, I think it's a really great question because there is a lot of misinformation out there. You can read something and say, I don't know, should I believe that or not? I've heard different things. You might have someone, a friend, a loved one that you really trust that says something, and even though that they're a wonderful person, they may be a Christian, it doesn't mean that that information is necessarily correct. They might be passing along misinformation without even knowing it. And so I think that this is really a role for physicians. We are not merely dispensers of pills, but we are also counselors. We should be aiding patients with shared decision making, sharing our knowledge base to give patients our information to make correct decisions. And so when approaching a medical decision, I recommend that patients involve a board certified medical doctor to help with that decision making. Now, I'm honored to work at Mayo Clinic. Mayo Clinic was rated the #1 best hospital by US News and World Reports, and I believe that. It is a wonderful place to work. And I think that Mayo Clinic is a trustworthy site where you could look for medical information. I think that it's someplace that I trust my care. I trust my family's care, both my wife, my children, my parents, to come to Mayo Clinic. And so that website is a reliable source. I'd say if you have vaccine specific questions, the Center for Disease Control, or CDC, is a very good place to go for information that can be reliable.
Well, this past year or two almost, has been really hard, especially for medical professionals. How do you deal with the stress of being a physician in a pandemic?
I'd say coffee is a great answer there. Maybe some nerd activities. You can see I've got the Lord of the Rings posters here. So I I enjoy time off with my family, certainly as a stress relief, but I don't think that's what you were really asking. You know, burnout, provider burnout, and fatigue is absolutely real. There have been incredible challenges being a medical professional with the pandemic and with some of the decision making and patient care that's happened during the pandemic. I take joy from helping patients and improving the health of those patients. I really care about the people that I take care of. But even when medical care is done correctly, when it's, and I'm going to put it in air quotes, perfect, there can still be adverse outcomes because we are all mortal. And seeing people die or seeing adverse effects from illness can be heartbreaking. I have kind of looked to medical education and research as ways that give me a break or a different view of medicine than just patient care, because I find those revitalizing. It keeps me passionate and interested and allows me to pursue medical care in various different forms. I'm really glad to have my family for comfort. And I also find that prayer is a way that I can seek refuge and look to God for answers and guidance when I'm feeling worn out, or in those wee hours of the night when I'm driving into the hospital to help someone, that I can turn to God and say, thank you for being there for me.
Well, Doctor, I thank you for spending time with us today and answering our questions. Maybe we can just close by asking you, are there any other thoughts or recommendations you have for our viewers who are listening?
I think I would emphasize again, I think I've said this, and maybe not in as direct of words, but being a Christian does not mean rejecting science. I have been so fortunate to grow up in a family that is a wonderful role model in that regard. I have met many Christian physicians and scientists along my pathway, training to become a medical doctor. And as a Christian physician, I am thankful that God has guided my pathway into a role where I can help others and improve their health. Please keep me and other medical providers in your prayers. I think that's a wonderful role for prayer, to pray for God to move in ways to help physicians and medical professionals to care for patients in these difficult times. And I wanted to say thank you for letting me come on and chat with you today. It's been a pleasure joining you, and I appreciate it very much.
That was great to have you.
Yeah, thank you.